Oh,
We are recording. We are back. part two. So I want to quickly show you guys. Okay. And you can see when you go to All Star, there's a list of courses right here. And Quick Start would be, some phone skills and some scheduling skills, some stop cancellation stuff to get you started. And you can go then through Phone Success. It's more in depth, scheduling more in depth, customer service more in depth. Quick Start's a nice overview of everything, and it shows you your progress as you go through each of these different chapters. These are all sorts of different things. Okay? Make sense?
Yeah.
yeah.
And then,
Some of us have done some of that.
okay. And then is everybody aware about call grades and what they are and why we do it? Okay.
Well, not everybody is.
Okay.
Yes,
So call grading is something that we had to really think about. How do we want to do this and how do we want to do it well? So a couple things. One, we never want to do a secret shopper. I'm never going to call your office and pretend to be a fake patient and test you. That's not what we're going to do. That's not what we're about. And we're not going to try to get you to fail. That's not something that we're interested in at all. Some other consulting companies do that. We don't do that. But we do want to give you access to hearing yourself with your patients. We will randomly, somebody at All Star will randomly select a call that you've already recorded on your end, and we will grade it. And it will use the great call sheet, which we're going to talk about. They will use the great call sheet to say, hey, are you hitting all of these steps? I'm not really worried about the score. A 40 is perfect. If I were to be graded, I would probably not get a 40. Why? Probably because I'm going to miss one thing or I'm going to do something out of order. It would be highly unlikely for someone to get a 40, especially all the time. That's pretty impossible to do. Does that make sense?
Yeah.
Yep.
What I am concerned about is looking at, okay, what boxes did I not hit this time? And how can I grow? How can I get better based on that feedback? That's it. It's like an athlete watching film. You watch yourself and I didn't realize that he was over there doing that and I was doing this, and you hear something different. Okay. So I listen to them periodically. Doctor and I will jump on, listen to a couple of call grades, listen to them. And what I'm listening for is success. I'm listening for how good of a job are you doing on the phone? No matter who answers the phone, I'm looking for how good did they do it? Okay. All right. Is that fair?
Yes.
All right. And then I'm here for you. I'm here to support you. If you got patients who aren't scheduling, they're saying something, you're like, I don't know, this didn't go the way I wanted to. Happy to review that with you and support you in that process. Okay. Let's dive in. So we finished the last section talking about the determination. Remember, you're going to be successful with achieving your goals if you have intention, determination, and you use effective mechanism systems. Foolproof. Okay. So when I weighed more than I weigh today, I'll just put it like that. When I weighed more than I weigh today, if I didn't have determination on my side, if I wasn't determined to lose weight or to get in shape, then I wasn't going to do it. If I didn't have a system for doing that, for me, it was standing on the scale every single morning. You weigh less in the morning than you do at night, I guess. So stand on the scale in the morning, look at that number and go, okay, what do I want? Where do I want to get? And that had to be my inspiration for the day. If I didn't step on that, I just let loose during the day, right? But that was my system for achieving growth in a different way, growth down. So I want you guys to understand that you have every capability to be determined to make this happen. So we're going to talk about determination. Have you ever heard of the phrase approval addiction? Have anybody ever come across that phrase before?
Yes.
Approval addiction? Okay. All right. Some of you. Okay. You might have heard fear of rejection. Have you heard of that before?
Yes.
Most people have heard of that before. Okay. I don't know that you have to have this absolute fear of rejection. Oh my gosh. But I think more people have a subtlety to that and have approval addiction. I think all of us have some level of approval addiction in different areas of our life. Oh, I just want them to like me. I hope they really like me. When we do that, it hinders our ability to be effective. So to understand this, I want to talk about self-esteem. And we'll spend about a half hour on this whole topic, and then we'll dive into some verbal skills. So I want you to imagine your 5-year-old self, maybe to 18, somewhere in that range. You're 5 to 18 years old, all throughout that time, and you're developing your self-esteem, right? I think we're still developing our self-esteem, but specifically at those times, you're so formidable. Like people are helping you form who you are, right? And you're forming who you are. And so I want you to write down the word self-esteem. And while you write that down, I want to talk about why this is important. Imagine if you were to take your grandparent, your parent, to a surgeon, and you were picking up that surgeon who was going to cut into your family member wasn't very confident, you probably have reservations about working with that surgeon. Am I right? Okay.
Yes.
So how your confidence and how you present yourself to your patients plays a huge role in your case acceptance. If they see you as lacking in confidence, they're going to lack confidence in you. Does that make sense?
Okay.
All right. So self-esteem, you wrote that down. We're going to define that. This comes from a book called Search for Significance by Robert McGee. And he's a Christian author. And also another Christian author, Joyce Myers, wrote a book called Approval Addiction. But this specific part comes from Robert McGee's book, Search for Significance. Phenomenal book. Very, very interesting. So he says in there, hey, we got to define self-esteem. How do we create it? So self-esteem equals, you're 5 to 18 years old. How are you guys tell me, how are you developing your self-esteem? Where is your self-esteem being created? How are you getting it?
Your day-to-day life, interactions with people.
Okay, so let's do that. I heard school, day-to-day. Okay, he calls that perception of others. So you can write down perception of others. Okay? You said interactions, right? Interaction with people, school. Okay, doctor, what did you say?
I said how you're raised.
Okay, how you're raised. Okay, so perception of others plays a role in that. And then on a sidebar of that, it would be performance, right? I perform, therefore I get feedback from people, perception of others. So performance plus perception of others, self-esteem. Now, I would say 99% of the time when Lynn and the rest of the coaches and I ask offices, hey, where does self-esteem come from? This is the definition. These are the things that we hear, what you guys are saying. And what Robert McGee says is this is not correct. This is not healthy. So draw a Ghostbuster circle and put a line through it. That's a bad definition, right? Draw your circle line through it. And what he says is, look at the word self-esteem. Where does self-esteem come from? Where ought it come from?
Yourself.
Yeah, Karen, yourself. Yep. 10 points, 10 points, 10 points, Karen. Yes, from yourself. Now, how do you do that? What do you mean from yourself? Because here's what happens as you grow up. You know, other kids are mean. There's bullies. They make fun of you. They, you know, and even the bullies are having a hard time, right? They're not feeling great about themselves on the inside. They're being bullied at home, and that's being reflected here, what have you. Just ask my wife. She has all the counseling stories to tell you, okay? So what we have to understand is while we were being wired at a young age, could have been healthy, could have been unhealthy. We don't know. But about age 22, we really start figuring things out in a better way. We really start figuring things out in a better way. I just realized I need to do something so I don't get feedback in the recording. You guys can still hear me okay?
Yes.
All right, that way you're not coming out of my phone and going in the microphone. Okay. How many headsets can I try on today? That'll be the test. So I want us to recognize, and some of you have already recognized this, that you are in control of your self-esteem. That you dictate. You've probably heard the saying, we teach people how to treat us.
Yeah. Yes.
Okay. And as a child, especially a high schooler, I have a 15-year-old. Only thing she cares about is, what do people think of me? It's the only thing she cares about. And I try to tell her, that's the last thing you ever need to worry about. Who cares what somebody else thinks about you, right? How's my fit look today, Dad? Right? This is what she says. Oh my gosh, this other girl, she was so mean to me today, and whatever it is, right? So your brain at that age cannot create the realization that, it's just about me. It's just about me. You ever heard the story about having two voices in your head, in your mind, right? Up here, okay? And there's a Cherokee saying, I posted on my social media, and it was this great story. This Cherokee story is amazing. This grandfather talking, he's talking about, there's two wolves fighting for your attention, right? You got envy, jealousy, anger, hatred, demise, and you've got joy, passion, happiness, encouragement. And they're both talking to you and fighting. And the grandson says, well, which one's going to win the fight? And he said, whichever one you feed. Mm-hmm. And so we call that self-talk. Your self-esteem actually comes from your ability to choose the right self-talk. When you wake up in the morning, there's an alarm that goes off. And what's the button you push on that alarm?
Snooze. Yeah.
Nobody ever says the off button. Oh, 5 more minutes, Dad. All right. Here's my question for you. And this is just for you to answer for yourself internally. When that alarm goes off, what do you start saying up here? Because what you start saying up here at that moment starts to create the direction of your day. It starts to impact your self-esteem and how you portray for others to treat you. So if my alarm went up this morning and I was like, oh my gosh, I can't believe I agreed to start at 7 a.m. with Dr. Borenstein. I can't believe why would I do that? Oh, I got to hurry up and get ready. Come on, let's go. Everybody, let's go. If I started doing that, imagine how I show up here. Right?
Yeah.
So immediately, my alarm is not a sound anymore. My alarm is a song, right?
I'll go around the back. Sorry, go ahead.
Okay.
Oh, well, time out for just a few seconds.
We're going to push the pause button on the recording. So my alarm, I immediately go to music. I have to play something that gets going. I'm old, so I stretch, and then I immediately start my prayer. You can talk about meditation, whatever it is, and my self-talk. What I'm speaking to myself will determine how the day is going to start out for me. It is a fact. The challenge now becomes, what do I say throughout the day, right? You have bad traffic on the way to the office. Oh, this is just great. Now I'm going to be late. And right, you start saying things like this. You hear something on the radio. Somebody got robbed and whatever, I don't know, whatever it is, right? Somebody else had something negative happen to them because something else negative, right? Negativity begets negativity. Positivity begets positivity. I'm going to generate my own positivity in my life. Does that guarantee everything's going to go perfect today? No. I could leave here at 1:30 for my 5:55 flight. And if I hit traffic in Woodland on my way to Sacramento Airport, you're going to see me squeezing the steering wheel, right? But if you think about the growth formula, mechanisms, I have a system in place. I've got an alarm to go off to tell me what time I need to leave today. If I have intention, if I have determination, I have attitude that creates that determination, I have a greater chance of everything moving in the right direction. So when your patient's sitting in front of you, if you've had negative self-talk all day long and they're sitting in front of you, or they're on the phone with you, they're going to pick up on that, right? Yeah. Results go down. This works in your family life, personal life, or your personal life. In fact, we're taking it from personal, we're putting it in professional is what we're doing. We're taking personal life coaching, we're putting it in professional situations. Okay. So you guys moved your chairs now. Karen. Yes, Karen. Okay. So when you answer the phone, have you ever had, I know this is a silly question. Have you ever had someone on the other end and you could just tell they were having a bad day?
Yes.
Okay. Isn't it true that your automatic, I look at your notes and everything, you just tell me honestly, isn't your truth when you can tell someone's having a bad day, you have two choices. You can go, oh, you want to be negative with me? Here we go. But isn't it true that when someone's having a bad day, like just things haven't gone their way, we automatically want to support them in that?
Yes. Well,
You almost go, not like they're being mean to you, not like they're being rude, but they had a bad day. Something negative happened. I don't know, cat got run over. And they share that with you.
in the middle of the road, they got stuck.
Something happened. Our heart immediately goes out to them in that situation. Is that fair? Is that okay? I don't know how it happens clinically, but Karen and I, we will have this thing going. Okay. So when we're having a bad day, what's our reaction? How do we talk to our, so somebody talking to us, oh, hey, it's going to be, you're going to do the blah, blah. But how do we talk to ourselves when we're having a bad day? How does that go?
It's the opposite. We're more encouraging and empathetic and trying to lift somebody else up, but we're more
Beating yourself up.
yeah.
Exactly. Isn't that weird?
Yeah. Never thought of it.
Why is that?
'Cause we're
Why
all-
do you think that happens? What do you think? Huh?
I want you to tell me.
Bingo. All right. Here's another factor. When you're the person in that frustration and someone's trying to, oh, it's going to be okay. Do you really want to hear it?
No.
Isn't that weird? Isn't that weird? Here's an interesting thing that you can do. Life hack. Here's what you can do. You can start to create a habit, something in your life that when things negative happen to you, don't be ignorant of it. And like, oh, I got a flat tire. It's okay. Not like that. But you can look at it and go, wow, this really sucks. How am I going to get myself through this? Wow, this is really not good. How am I going to get myself through this? I can't believe that happened to you. How are we going to support you in getting through this? It's a question. Do you hear how it's not, oh, rainbows and sunshine? That's not what we're talking about here. But when you have determination and intention, when you have the ability to say, Dr. Bourne, it's Monday morning. I just checked the answer machine and the schedule has completely fallen apart. And I want you to know that I want to work with us together to talk about how we're going to make this right. Instead of, oh, the patient's canceled. Can we go home? Right? Or, hey, all the patients canceled, but it's okay. We're awesome. That's not what I'm saying either. Do you hear how we're finding middle ground in this?
Yeah.
Mm-hmm.
Mhm.
It's not really fake it till you make it. That's not really what it is. I don't believe that we're perfect. We are not perfect human beings. So self-esteem, right? You're going to define your own self-esteem moment by moment. We're not perfect. Nobody is perfect. Everybody's got flaws. And if we're all getting graded on a curve, then we're all 10s. So our system, our mechanism is called being a 10. So on your self-esteem, I want you to put this. I define it through my self-talk. I define my self-esteem through my self-talk. Number 2, you could put, I am a 10. Now, Doctor and I are old enough to remember a movie called 10. Most of you are not old enough to remember that movie.
I am.
Okay, all right, fair enough, Karen. All right, so yeah, so Bo Derek did this movie 10. And it was all about physical beauty. I do not want you to get confused with what we're talking about here. This has nothing to do with physical beauty, your intelligence level, your gracefulness and an athletic ability. That's not what we're talking about. We're just talking about the fact that God doesn't make junk and he didn't start with you. Is that fair?
Yes.
Yes.
Okay. So You can only know what you are saying between your ears. And I cannot have you saying negative thoughts in your mind and listen to what I'm saying to you and implement what I'm saying to you, and you deliver to a patient and you be at your A game and you on growth pattern when you're doubting yourself. You cannot have healthy growth with unhealthy self-talk. Do you see the conflict?
Yeah.
Okay. I'm not asking for perfection. I'm only in pursuit of excellence. Right? We're in constant pursuit of excellence. We're constantly moving in this growth pattern. You cannot grow this way when inside you're doubting that ability. When I said earlier, a surefire way to achieve goals in your action, in your results from it, in your action, growth, guaranteed hit your goals, grow, guaranteed growth will come from mechanisms, systems, plus intentionality, determination. You went, I don't know, there's guaranteed to hit goals. I want $1 million, Eric. Right? Okay. Well, SMART goals are realistic, attainable. Are they really realistic and attainable? Maybe not right now, but it is attainable. If any of you told me that you wanted to make $500,000 a year, I would help you come up with a plan on how to make $500,000 a year. Right, Lynn?
Let's do it.
Okay. All right. Now, I struck a chord. All right. But here's the thing. John Maxwell calls it the law of the lid. If you ever think, I'm not going to make $500,000, guess what you just did? It's not going to happen. You just determined your intentionality just went fizzle, can't happen. So when we do high performance coaching, so my coach, Michael Daphne, he coaches Major League Baseball players, U.S. Olympic triathletes, big CEOs of banks, all this kind of stuff. He's way out of my league, but I love when he coaches me because he teaches me how to coach you guys. So here's what you do. You have small steps that you hit. Atomic Habits by James Clear. Small things that you do to achieve a big thing. You can't just go, I want to make $200,000 next year. That's not how it works. You might say, I want to make $200,000, but I want to grow it this way. You might say, I never want a patient to cancel in our practice ever again. Okay, it starts with decreasing at 1%. You can't decrease it by 50% without first decreasing at 1%, right? So don't let the belief of, I'm never going to get way out there, stop you from just going this far. Make sense?
Yes.
Okay. So we're going to have 10s on our forehead because we teach people how to treat us. So when that patient walks to the door or when they're on the phone with me, thank you for calling Dr. Boren's office. This is Eric. How may I help you? They're going to treat me like that. You hear it?
Yes.
Little things that make a big difference. That's what we're going to talk about. So we're going to be a 10. You're going to hear me say systematically, the mechanism is 10. The intentionality comes from your self-talk and your ability to do that. Without those things, you cannot implement the things that we're going to talk about. Okay. So let me give you some life hacks. Okay. Life hacks. When you, they'll be like verbal skills. When you talk to patients, we have a tendency to shoot ourselves in the foot when it comes to case acceptance and cancellations. Earlier, we talked about no pain, no problem, no pay. Oh, it's not bothering me. I'm going to go ahead and wait. You know why they have that perception?
They're not educated.
And who educated them?
We did not. Yeah.
Okay. When you speak in a way to your patients, you do it by framing something. You give them information. I'm giving you a frame right now. I'm creating a perception of who I am based upon what information I'm giving you, what information you're allowed to see. I must like fish. I prepared you the dogs are going to bark without telling you the dogs are going to bark. Right? I said, you'll meet them later. You know when you'll meet them? When somebody knocks on the door, delivering another package every single day, Amazon. Best buds. You can't see my books on my shelf with all my Disney pictures. right? All my favorite stuff. You can't see my messy inbox over here. Why? Because I framed it for you not to see those things. I let you in on some things and I don't let you in on others. That's just how life works. I call it framing. It's happening all the time. I can't see who's over there, right? You guys didn't know this probably, but I heard you talking about creatine and the kid and the football and all that kind of stuff. And I was like, this is great conversation. Okay, right? My son Tyler too, he's all jacked, we hear, in other words, framing is happening all the time, whether you're conscious of it or not. And what I want to trigger you to is making a conscious effort in what you say and what you don't say. Now, scientifically, this is called NLP. Okay. Now, anybody know what NLP is?
No, NLP.
It stands for Neuro Linguistic Programming. Neuro Linguistic Programming. It's a real thing. Okay. It's a real thing. It exists whether you want it to or not. Imagine you're a child, you're sitting at the dinner table with your siblings, and one of your siblings spills the milk, and dad says, "What's the matter with you? What's wrong with you?" There's programming occurring in that moment. We've all experienced something like that, whether our family or at our friend's house or something. Okay, make sense?
Yes.
You are programming yourself with your self-talk. You are also teaching people how to treat you through, I'll call NLP framing from now on, how you frame it. You can do a really good job of that, or you can do a really bad job of that. And they say, yeah, it's not bothering me. I'll go ahead and wait. Oh, it's just a cleaning. You know what, Karen, put me down for something in 6 months. And if it doesn't work, I'll let you know. Ring a bell? We teach people how to treat us and how we frame things. So your first framing tool is called eliminating limiting terms. I want you to write this down. Eliminating limiting terms. Okay, what do you think that means? Eliminate limiting terms. What do you think that means when you first hear it?
Well, there's gonna be certain, I hear it and I think there's gonna be like certain words or catchphrases that you're not gonna say to the patient because it's gonna limit their response.
Good, who said that?
Karen?
Karen, I was looking down at my notes. You're exactly right. You're exactly right, 10 points. Things we say that negatively affect their ability and willingness to drive through with care, to push through with care. Okay, I'll give you an example. Earlier, I talked about push purchase versus pull purchase. Okay. You need a crown. Let's see, who's Ingrid, right? Where's Ingrid? All right. Ingrid, you've been here for about 7 months. Is that right? Okay.
Yes.
Prior to that, how many years have you had in dentistry?
No.
Perfect. Okay. Imagine you're the patient. When the patient hears the word crown, what do they think of immediately?
A lot of money.
You get 10 points.
Yeah.
Is she right?
Yeah.
Absolutely. So let's talk about it all the time because we love to talk about how expensive things are. We shoot ourselves in the foot and we say things like, you need a crown. And they go, it's not even bothering me. Why would I spend $1,500? It sounds expensive. You guys have all seen that meme with the cartoon and she's in the car in the parade and she says, my dentist said I needed a crown. And I was like, I know, right? And she's putting a crown on her head, right? We frame it in a way that shoots us in the foot. I'm so glad we're visual. I love to use my hands. Okay, so we're going to eliminate limiting terms. We're going to switch this. I'm going to give you 3 categories. Here we go. Number 1 category that we use, okay? Number 1 category that we use limiting terms in is minimizers. We say things that makes it sound like it's not that big of a deal. Have you ever heard of the word pinhole cavity? The phrase pinhole cavity, ever heard that? Okay. Have you ever heard someone say something like, it's a small cavity?
Yes. Yeah.
You have a little bit of bleeding here. Lynn as a hygienist, that one drives her nuts. They have a little bit of bleeding. You have a tiny something. We work in a small world, the tooth, it's very small, and little things happen to that little thing, and I get it, but it's doing us a disservice. Karen, how expensive is a posterior composite one surface, like resin filling? What's that price?
113.
It's gotta be like $200. Oh, maybe with insurance fees.
Your
Office fee though?
I can't tell you the last time I had one that wasn't on insurance.
Okay, we're gonna fix that today. So let's say it's like 200 to 250 is typically what I hear, which tells you, wow, if insurance is doing 130, what does that mean, right? That's painful. So what are we gonna do about that? We're gonna fix that, right? How are we gonna? There's your response to that. That negativity, it's there, but how we respond to it. So when something is $200 and we say it's a little cavity, does $200 sound like a little bit of money to you? No. And you hear there's a disconnect. And this is where we get patients complaining because we framed it that way. So limiting term category number 1 is it's called minimizing the condition. Minimizing the condition, okay? And you can always use the word pregnant at the end of the sentence to help you determine if it's a limiting term. If you said, well, it's a little bit of pregnant. It's a tiny bit of pregnancy going on here. Small amount of pregnancy. It's a pinhole pregnancy, whatever, right? Okay, gotta have fun with this. All right, category number 2. By the way, we're all guilty of all of these at some point. We're just gonna be cognizant of it now, right? So category number 2 are filler words. Have you heard me say or yet?
No.
Okay, that's great. Lynn is going to count them for me. She's going to count how many times today I say or Why would that be important for me to be aware of that? What do you think?
Because those are words that signify you're not focused on the conversation.
Or may not be as confident.
There we go. Yes. Yep. Exactly right. And that's exactly right because it creates doubt in your mind. And if it creates doubt in your mind that I'm not confident, it decreases my credibility of what I'm teaching to you. I call it weatherman syndrome. Slight chance of increasing cloudiness with partial percentage of precipitation may increase throughout the day. What is it going to be, man? What's it going to be? Don't shoot the messenger. I don't know. Just doesn't sound very confident, right? I'll give you the example of filler words you guys use in your practice. Everybody uses this in their life. Kinda. It's just like, possibly, maybe you want to think about someday considering a slight chance of, you don't have to write them all down. I see good writing down. Okay. Maybe you want to go home and think about it. Maybe, kinda, like. Oh, here's a good one. This is the new one I hear from the younger generation, like. Oh, shoot, I just lost it. It's just like, that's the phrase. It's just like. And that little phrase wreaks havoc in shooting ourselves in the foot. Sometimes people overuse terminology. Well, to be honest, if I'm going to be honest, well, were you not honest before? Okay. So you might have some phrasing that you put on repeat. Okay. So my daughter says it all the time. She says, literally, that's it. Literally. And I go, did it literally happen or not literally happen now? Literally, she said, Dad, like, okay. So there's phrasing that we use that we have to be cognizant of, that we have to be aware of. And I want you guys to be listening for it. So that's category 2, filler words. They create doubt in the patient's mind. Category 3, I know we're all guilty of. It's called dental jargon. Dental jargon are the things like crown, the things we say that distract from what we want them thinking about. We say things during the exam. So let's see. Anissa, when doctor's calling out treatment to you, you're charting it, right? You're putting it in the computer?
For the most part, yeah.
Okay. When that happens and he's calling things out and patient's hearing what's being said, it's called overhear psychology. If he were to say something like this, it's great for you to chart it, right? If he says, thirds are missing. Number 2, MODL amalgam with defective margins. There's a class 5 on the buccal. I'm concerned about the furcation level here. And let's do a crown buildup, crown lengthening, and a crown on this tooth. Now, out of all that, what'd the patient get?
A bunch of gibberish for one.
Yeah.
And 2, they're probably thinking, wow, what is all this? It's a lot of treatment. This is probably going to cost a fortune. What the heck did they just say?
Okay, what the heck did they just say? This sounds expensive, to sum it up. Yep. Okay, Lauren, in hygiene. In hygiene, right? I'm going to evaluate the health of your gums today. Periodontal disease, don't worry about it. Do your thing, and you start calling things out. And I had a patient say to us, our hygienist, one time, when we explained what was really going on, he goes, I thought they were telling me the years that I was going to be able to keep my teeth. 333, 333. Okay. So we have to understand this, that patients don't get it. We got to explain it in a simple way. So dental jargon, category 3, dental jargon is really important. So if I had to replay that, right? And now, so Nissa and I, we have a patient, Ricky Bobby's in the chair, and Nissa's charting, and I'm calling out, I'm doctor. I say, Anissa, thirds are missing. Ricky Bobby, did your wisdom teeth ever come in, or did you have them removed at some point in your life? Okay, teenager, all right, great. Right, so those are teeth are missing, which is great, creates a healthy space for the rest of your mouth. That's great. Tooth number 2 on the upper right, we're gonna start with. Anissa, MODL amalgam, there's defective margins there. There's a large old metal filling here with a large gap. It's like a metal piece of the puzzle's in here, but the puzzle's worn on the outside edges, and I'm concerned about a cavity, active decay underneath this filling, reaching the center of the tooth. Foundation full coverage. Okay. Now, Nissa, did you get everything you needed to chart?
Yes.
What's the treatment plan? What did we just treatment plan?
Oh, was I supposed to write that down? I'm sorry.
No, it's okay. When you hear me say foundation full coverage, what do you think we're treatment planning?
A crown.
Crown and a buildup, right?
Build up, yeah.
But what is the patient here?
Big words. Big words.
Yeah, that part they don't understand, right? Foundation, they don't. But in the middle, they heard puzzle piece, active decay, concern, right? Those are the things that resonate with them that they get. Right. Assistants, you ever have, sorry, doctor, I'm gonna pick on you a little bit here, but you can handle it. You're a 10. You ever have the doctor, he does all the dental lingo, he's used all the big words, which is great. We understand it. He looks at the patient, says, do you have any questions for me? They always say, no, they don't want to look stupid in front of the smartest person in the room. Doctor leaves, and they immediately turn to you and start doing what?
That was in unison.
Immediately.
We all know this. Now, if I can get all of you to eliminate limiting terms and frame it right, that goes away. They still have some fear of white coat syndrome, and so they don't always hear everything, but we get them there, okay? So we're going to play a game where you guys track your limiting terms. You're going to have a whiteboard, maybe down in the room, you're going to have a piece of paper, something where you are actually writing down every time in the office you hear a limiting term. When you hear need, crown, even cancellation, opening, changing the schedule, all of these things that speak something that we need to be cognizant of and we need to write down. Now, you don't have to write down who said it. We're not trying to blame anybody. We're not trying to make somebody feel bad, but we're going to write down all the words we hear that are limiting. You'll notice when I role play, when I become a patient or you, I'll say, when you go into acting mode, right? When you're a real human being. When you're here in this mode, you're on stage. Smile, you're on stage. You have a performance level to live up to. I am certain those of you that have kids don't say everything to your kids in front of them when you and your significant other are speaking. There are things behind the scenes that you talk about that you don't say in front of your kids. There are some things that you do want your kids to overhear. That's on purpose. Same thing when we're at work. There are things we don't want our patients to hear. There are things that we need them to hear. We're going to frame that in a healthy way. When you use a lot of limiting terms, it's a signal that you don't have a 10 on your forehead. Role play mode, okay? So don't count these, Lynn. Don't count these. So you kind of have a cavity in there. Don't shoot the messenger though. And you know, we would recommend that you possibly get an appointment scheduled. I have no idea how much it's going to be. Talk to Karen about that. Okay. All right. Go up front. Thank you. I got to clean my room. Okay. I'm exaggerating it. But you might have heard a percentage of that could be relatable, right? And maybe you've grown out of that. You know, if you have years of experience, you can grow out of that, or you can grow bad experiences, bad habits over the years of experience. Experience does not equal expert, by the way. I want you to hear that. Experience does not equal expert. I was working with our coaches yesterday on this. Expert does not mean experience. Just because you can teach it doesn't mean you know how to do it. Just because you know how to do it doesn't mean you know how to teach it. Are you getting what I'm saying?
Yeah.
Okay. Some of you have all kinds of experience and you are an expert. That's what I would want. I want both of it. Some of you don't have the experience yet and you're like, I don't know if I could talk about that yet. I don't have the experience. Yeah, actually you don't need the experience to be an expert, because you know why? That patient who walks in knows a lot less than you do. You have 1 day of experience, you know more than that patient, right? Now it's just up here. Now it's just, how do I communicate this to the patient? They are looking to you as the expert when it comes to their healthcare. You better present as such. Because if you're wavering or doubting, sound like you're wavering or doubting, they lose confidence in that. And they cancel, they schedule. Karen, you have somebody, you go to the financial rangers, you go over everything with them, it's a couple crowns, upper right, they do us, and you just, they walk away, and you get this feeling like they're not coming back. They cancel on the answer machine in the evening because they know you're not there to answer. They didn't get it. They didn't get it. And I know this because hygienists, if they knew what you know, and I'm not blaming you for this, but if they knew what you knew, they would get it done as long as money were no object. Is that fair?
True.
Okay. Just because you guys have the most years of experience here, I'm using you guys. Our job is to quickly get them there. You have an infection in your gums. It's the foundation of your teeth. Have you ever seen somebody with really long teeth, black spaces in between them, in between their teeth? That's someone who has advanced gum disease. You have the first stage of gum disease. It is now there. It is not curable. It is only manageable, and I'm concerned about it. How concerned are you with having me help you prevent you from losing your teeth? It doesn't take long to be an expert. I know nothing about how to treat perio. Lynn can attest to that. Okay. You do not want me in there prepping a crown. There'll be blood everywhere. Was that your tongue? I'm so sorry. So, but I do know how to talk to patients. I do know how to talk to patients in a way that helps support you to support them in getting it done and getting healthier. And I love that apart. I love when I do these meetings with people. And next week, my prayer is that you guys are going to send me a message that says, you're never going to believe it, Eric. I got the most difficult patient totally converted to getting their mouth healthy again. That's what I love to hear. That's my goal, is to say, if I just get you guys moving in that direction, it's just momentum's going to take care of itself. Eliminate limiting terms is a great way. It's my favorite topic to get rid of this. So, leads. I need a leader. We create a leader by saying, I'm going to be the one that reminds us to do this. I'm not the one doing it. Leaders don't do it all. They just tell us what to do. Okay. So I'm going to be the one that reminds everyone to eliminate limiting terms. Who wants to be my lead for that? Limiting terms lead. Who is that? Give me a name.
Lauren.
Anissa's doing front and back, so you know that'll be good for her to do that.
Okay, I typed Lauren. Now I hear Lauren nominating someone else, and so are you guys nominating each other?
Yes.
she's the front and the back.
Okay. All right. Anissa, you've been voluntold. All right. Lauren's up next. Okay.
Volunteers, here we go.
Everyone is going to be a leader of something. And Anissa, you're going to like this. The earliest things that we talk about are the easiest things to be the lead of. So congratulations, Anissa. All right. Here you go. All right. Now, next. All right. So you have self-talk, you have 10, and you have eliminate limiting terms. Number four, permission statement. We have to understand the sales part of this influences our determination factor, our 10. If we're nervous to sell, patients pick up on that. That example I gave. So when we're nervous to sell, we have a tendency to hold back, we self-doubt and all this. Well, permission statement is a tool to get through that, where you don't have to worry about selling being a negative thing. Walter Haley from Kerrville, Texas, he taught me, if you don't like the S word sell, get used to the B word broke. Okay? What I want to add to that is, as long as we sell the right way, when it's a want, not a need, we're not going to push. Is that fair? Permission statement allows us to sell in a way that is not pushy. Dr. Bourne, have you ever heard, I know we've worked on it, permission statement before. Before we started working on it, had you ever heard of permission statement prior to us talking about it? Was that something you're familiar with?
I think so.
Okay. It's been around for a long time. I'm not inventing this stuff, guys. I'm just bringing it to you. But it works two factors. It works for me to overcome my fear of rejection. But get this, guys. I don't know if you recognize this or not, but your patients, they're afraid you're going to try to sell them something. How do I know that your patients are afraid you're going to try to sell them something? Because they will say, all right, Lauren, when doctor walks in the room to do a hygiene exam, do you ever hear this from the patient? Don't find anything today, doc.
Oh, yeah.
Every day, I think.
Yeah.
Okay, right? The reason they say that, by the way, only 30% of people are external processors. The other 70% are internal processors. Inside words out. You guys had a George Bush. You guys remember that guy? I don't know if he's from your neck of the woods, right? Those are inside words. I mean, it meant to be outside words. No, it meant those to be inside words. That was his saying, he said, right? We have inside words. Sometimes we project them. When some of you are too young to know, you probably know who George Bush is or even remember that saying. So I'm aging myself here just by using George Bush. That was Junior too. All right. So everybody's thinking it. Only 30% are saying it. Don't find anything. Don't find anything. Don't find anything. Nothing to see here. Keep moving along, doc. They're afraid that you're going to sell them something. You see, dentistry has an inherent problem, an inherent conflict. Dr. Bourne, I'm your patient, and I want to become your patient, which means you got to do an exam on me, right? To become your patient. I got to pay you money to tell me my problems. I got to pay you money to tell me my problems. You see where this is going? And now you're going to ask me for more money to fix the problems you say you found. You see the conflict?
Yeah.
Okay. The pharmacist doesn't diagnose you. He just sells you the pill. The doctor doesn't sell you anything. He just describes something to you. Your car's making a weird sound. You pull the mechanic. He didn't have to tell you there's a problem. He just tells you how to fix it. You see the problem we have? We have to recognize that this patient has a fear of being sold. Yet we're in sales, but this patient has a fear of being sold. So how do we do this in a healthy way? Permission statement is a phenomenal tool that will allow you to completely wipe this out. You won't have fear of rejection. They won't have fear of being sold. Make sense so far? Okay, you ready to hear it? Okay, that'll be next meeting. I'll tell you how to say it next meeting, okay? No, I'm just kidding. Just see if you're awake. Okay, so I'm the doctor in this scenario. Oh, I'm the doctor. All right, I talk a little differently now. So Ricky Bobby's the patient, shake and bake, Ricky Bobby. And I say, I'm getting ready to do an exam. I say, Ricky Bobby, this is hygiene or new patient. I say, Ricky Bobby, I'm going to do an exam and I want to be able to share with you everything I see that would deserve your attention. Is that okay with you? Now, what's Ricky Bobby going to say?
Sure.
No, he's going to say, shake and bake. No, he's going to say, yes. Yeah. Okay. Why? Because he's thinking, duh, that's what I'm here for. Of course. It's not for his benefit that I say that. Who's benefiting from that patient being okay with me telling him what I see as the doctor? Who's benefiting?
You are.
Yeah. My fear of rejection just goes away when he says, yeah, tell me my problems. Okay, I'll take your money and tell you your problems. Okay, we're good so far. Halfway there. But he still has some fears that I haven't neutralized yet. Psychologically, he's thinking, don't find anything, don't find anything, don't find anything. He's got these earmuffs on and he can't hear what you say. That's why when the doctor leaves, he turns to the assistant and goes, what? He's not listening. He's only worried about you trying to sell him something, or he's afraid of the dentist, white coat syndrome. Anybody afraid of roller coasters? No? So what happens when you grow up in Texas around like Six Flags and all those things, right? You just ride. People who are afraid of the roller coaster, all the screaming that's going on, the anticipation of standing in the line, and you see a mechanic walk out with grease on his face, shaking his head like this. That's how they feel sitting in the dental chair when they have white coat syndrome, okay? So you're going to use a second part of this permission statement to neutralize that. Ricky Bobby, I want you to know that if we make recommendations, you're in the driver's seat. You get to decide at what pace you move forward with those recommendations. Does that sound fair to you? Now, what's Ricky Bobby going to say?
Yeah, shake and bake.
If you ain't first, you're last. That's what he's going to say. Pace, driver's seat. I'm going to be first. I'm going to get it done first. Okay. He's going to say, yeah, makes sense. And relax. You're going to see a physical expression of that result when you use that. So if I put those two things together, it goes like this. I say, Ricky Bobby, I'm going to do an exam today. I'm not asking permission to do an exam. Ricky Bobby, I'm going to do an exam today, and I would like to be able to share with you everything I see that deserves your attention. Is that okay with you? Shake and bake. And just know this, if we make recommendations, all of our patients in our practice, they're in control of that. You're the one that decides how you move forward with those recommendations. They're never going to feel any pressure from us. Does that sound fair to you? Yes. You guys hear it?
Yeah.
Now, hygienist, and Lynn loves this one, I'm going to evaluate the health of your gums today. I'm going to use my ruler and we're going to measure. We're going to see how healthy you are. We want to hear 1, 2s, and 3s. If we hear numbers bigger than that, that's a sign of concern. If that's the case, we'll talk about it. Does that sound okay to you? Yeah, sure, of course. Just know this, if we find concerns and if we make recommendations, you get to decide at what pace you move forward with those recommendations. It's always your call. We just want you to be informed. Does that sound fair to you? Okay, great. Now, do you notice how I finished both parts? What's the punctuation when I finish both parts?
Is that okay with you?
Yeah.
Yeah.
10 points, 10 points. It's a question. It's a question mark because I need that patient to be with me. I need to know they're with me. Do you notice I ask you guys all the time questions?
Yes.
I teach something, and then I ask you a question. Are you guys with me? Does that make sense? I keep having to say that, right? I want to make sure you guys are with me. I want to make sure it's making sense. I'm giving you opportunity to speak. If I just talk for 6 hours straight, it's going to be really, that's a big problem for you. Now, I can talk for 6 hours straight. Trust me, you can tell, right? I got no problem talking. That's not my problem. It's shutting up's the problem. So my life hack is I got to remember to give you pause, to give you opportunity to speak. Got it?
Yes.
Okay. So you have my permission to jump in at any time and say, Eric, wait. I want to talk about that. I don't like that. How does that work? Let me hear you do that again. I want to write that down. Now, you have homework. And that is to write out your own permission statement. admin, right? You say, I'm going to go over, I would like to be able to go over all the financial options we have for you. And just know you get to choose whichever one works best for you. Does that sound fair? Great. How nice of me. I'm just really polite and helping them pay me money. All right. We need a lead person for permission statement. Who's going to make sure we get our homework done? Lauren, she's like, early on, raise my hand early on. There we go. I saw Lauren's hand first. Okay. And I think Anissa threw her, like, voluntold her too. She's like, it's you. All right.
I feel that.
So 4 steps to having determination factor, right? To achieve growth, I got to have determination. It won't work. What we're about to go through, it's not going to work if you're wavering, if you're doubting your ability to do this. It will not work. So the 4 steps. What's the number on your forehead?
10.
10. If you at all think that the number on your forehead is 9, that is a problem for me. You don't know this, but it's a problem for you. You're like, I'm not a 10, I'm a 9 though. No, it doesn't work that way. It's 1 or 10. If you're a 9, you might as well be a 1. When you're born, the light is turned on, and it's a knob. It's one of those dimmer switches. What you have to recognize that every day for the rest of your life, your hand is on the brightness. You're determined 1 dim or 10 bright. You and you alone. Nobody else's hand is on that. You might think other people are making you feel that way, but your reaction to that is you. You with me?
Yes.
Okay, so if you thought, oh, I'm a 9 right now, but a little bit more training and I'll be a 10, or I just need to mature, I need more experience, I'll be a 10. No, it doesn't work that way. You're not perfect. You never will be perfect, and that's okay. That makes us all perfect. We're getting graded on a curve here. Agreed?
Yes.
Okay, so be a 10. Self-talk is going to help you get there. The moment your day starts and throughout the whole day, your self-talk is on. What are you saying? Now, you could have a lead for being a 10 in your office. Had an office send me a picture yesterday, posted on my social media. They created a 10 board and they defined what a 10 is for them. What does that look like when you're being a 10 in our office? And they wrote all these things around the 10 and it's up, and then they walk in their team room. It's a reminder. So if you want to be a lead person for 10 in your office, you could do things like that. You can encourage people to be a 10. That's totally fine. Number 3, eliminate limiting terms. We covered that. What are the 3 categories of limiting terms? What's the first one?
Minimizers.
Good, 10 points. Minimizers. What's the second kind of limiting term?
Filler words.
Good, 10 points. Filler words. And the last?
Dental jargon.
Dental jargon. If you said that, 10 points. Good job, Izzy. All right, so when you hear limiting terms and you want to coach your team member, you don't say this. Wow, Lynn, you're really blowing it. I keep hearing you use all the wrong words. You need to go back and listen to the recording of Eric again. Gosh, you're really shooting yourself in the. Don't do that. That's not nice. This is how you do it. You say, Lynn, you're never gonna guess. I heard it. You're never gonna guess what your limiting term is. Can you guess what it is? Isn't that better? It's how you approach someone, right? Now we can have fun with it. And then I'll tell her, if you hear mine, I want you to tell me. You are not cognizant of your limiting term. Now, some of you are going to catch yourself now as we move forward. You're going to start, and you're going to catch me. You say, Eric said little. I'm not perfect. I'm getting better every day. Lynn, how many uhs or ums have I used? None. Wow. I'm on fire. You guys are getting the best. This is the best I've ever done. All right. Lastly, permission statement. 2 parts, not 1 part. I know I want you to do both parts. It's not, hey, can I tell you what I see? Great, done. No, there's a patient part 2. You got to do both parts. And Lauren is going to make sure we stick to this. All right. Part 2 done, but I want to hear from you guys. Have some of you heard some of these things before?
I've heard of a permission statement before.
Yeah, good. Have you been using it, Lauren?
Not always.
Okay, all right, that's fair. Yeah. Had you heard it with the 2 parts or just the get permission to tell them what you see?
Just to get permission to.
Yeah, that's what I hear mostly from teams is, oh, I always get permission to tell them what I see. Can I use the intro camera? May I lay your chair back, please? Those sorts of things. Totally agree. That's a really high customer service thing that we ought to be doing all the time. I'd love to take you back to the room if you're ready. All right, let's go. It's just a polite way, right? Now,
So what would be your way of saying, like, if it is a quote unquote little cavity, a small starting out, what would be your way of putting that if the patient were to ask, like, how big is this cavity? You know, is it small? Is it just starting?
huge. It's huge. No. No. Oh, I said it. There it went. There it went. There was my first Okay. Write it down, Lynn. 1. All right. So when I talk with a patient about a cavity, and we're going to get into this, it's called the 95-5 rule. So we're going to get it's going to be part like 3 today. I'm going to answer your question in depth. I just eliminate those words, those adjectives that make it sound small. So you have you have a cavity, you have active decay in your tooth. And the reason that's a concern about it is it's just like, you ever see that Tootsie Pop commercial? Have you guys seen that? How many licks does it get to the center of Tootsie Pop? You ever seen that? Well, the cavity is working its way to the center of the Tootsie Pop. It's not going to stop. It's a matter of time before it gets to the center of Tootsie Pop. Now, what happens when the cavity gets to the center of the Tootsie Pop? They don't know this, right? You guys know this, but they don't know that. That's the nerve of the tooth. They go, I don't know what, that's a toothache. Now, most people believe, oh, that's when I'll address this. Too late. You ever heard of a root canal before? That's why we have to do a root canal. We got to take the center of the Tootsie Pop out so there's no more feeling. That's the nerve of the tooth. That's what a root canal is. Our goal is for our patients to never have to get a root canal. So the sooner you take care of this cavity, the better. They're all important. Does that make sense, Ricky Bobby? Yeah, okay, great. Now, took me a minute, 1 minute to describe what that is. I use what's called a word picture to describe it. Why? Because if I start going, well, it's on the occlusal surface of your tooth right now, and right now it's in the enamel, and what's going to happen is once it goes to the enamel, it's going to hit the
Dentin.
dentin, and the dentin it eats through the dentin 10 times faster than the enamel. And I've used all that verbiage before. I've said all those things. And you know what I found is all they heard was wah 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 wah. They didn't get it. But for some reason, when I talk like they're a 3rd grader and I talk about a Tootsie Pop, they get it. Make sense? Okay, so that's eliminate limiting terms and use a word picture. We're going to get into that this afternoon. Great question. Okay, does that answer your question, Lauren? I don't know if I gave you a great answer, but. Okay.
Yeah.
All right. We're going to talk about overhear psychology too. So they're co-diagnosing with you. We're going to get to that. All right. I'm going to end the recording on here.